Great, welcome to another live stream. We are Renew Dental, Advanced General Dentistry. Here we talk about full arch rehabilitation cases where we are interested in using implants, bridge work, all the tools in the dental toolbox to help restore full arch cases that are kind of falling apart. Here's a case, an example that we have. This is a panoramic view of a patient's mouth. This is a pretty typical case that we look at on a daily basis. And here we're really only going to talk about the upper arch. I'll briefly talk a little bit about the bottom, but mostly the upper arch is what this live stream is about. And we'll talk about a little bit of the reasons why this person's in this situation. So you can tell that this person, all the white areas are crowns or fillings or something else, and the bone area is around here, and you can't really see the gums. And the big black areas up here are the sinuses and the nose here. So there's nasal sinuses right here. So just to give you a little orientation there. And the first thing we always ask is if patients are in pain. If they're in pain, we definitely need to get them out of pain, and if there's any active infections. We also are very, very concerned about irreversible problems that come up, like this lucency here, we can see in the x-ray. And when we take our CT, we are able to actually look across that tooth in a slice view, and that looks like this here. So when a tooth is devitalized or decayed to the nerve dies, and the body now sees that tooth is foreign and now wants to reject that particular tooth. That means that it has to reject it by eating the bone away, and we need bone for implants. Excuse me, wow. We need bone for implants, so we don't want the bone to be wiped away. So we need to get this tooth out as soon as possible so that we don't lose that particular set of bone, in case that's an area that we want to put implants in. Now, going back to this case, like I said, we're going to talk about the upper, and it's pretty clear to me that this person cares about their teeth because they've invested quite a bit of money in putting these bridges in, as well as bridges and crowns on the bottom. So I know the patient cares, but maybe the patient doesn't understand how to take care of the dentistry that they just purchased. Now, dentistry is only as good as the person taking care of it. Think about buying a car. When you buy a Honda Civic, you're not buying it to go off-road. But if you take it off-road and now you're trying to do four-wheel drive type things, that car is not going to last very long. Same thing here. You probably, have fillings and crowns, but if you don't properly take care of them, you're going to get recurrent decay, you're going to get recurrent infections, you're going to have problems. And then in this case, when this tooth fails, this entire sequence of teeth fails, because now it's a bridge piece, and that's a very expensive situation to deal with. It's no longer a tooth at a time. So what we're looking at here is that we're going to be extracting all of the remaining teeth here. There's really nothing else you could do with a natural dentition here, and there is no more miracles that restorative dentists could actually do. So given that, now what do you do, and how do you plan a case like this towards a full upper denture model? Now, there are treatment modalities you'll see in the media, in particular. The very, very popular tag words are all on four, hybrid, or teeth in a day. So people that are looking at full arch rehabilitation type work, they will see those two things going on quite a bit. And I'll explain a little bit about what I like and not like about those. But this is one of those cases where you would be looking at teeth in a day. Now, I call it denture teeth in a day because that's all they're really doing, except that when you place implants, they're cementing the implants to that denture in the first visit when they place it, which is not a smart thing to do, and I'll explain a little bit more about why that is. But let's look at this case here. The upper area here, like I said, is the sinus area, and if we go across to look at that, let's see. You can see how much bone we have. We really don't have really any bone. So now I'm in the first molar position, and that sinus bone here going across here, and then this is the into the maxillary sinus, and that's not a lot of bone. The problem is, how do you get bone if this is an area where you want to put an implant? That's not very good. So oral surgeons and the like think about putting bone in here, so they'll fill this up and allow that to heal. Well, that's not always successful, and that's a problem. If you don't have the capacity to heal bone, then it won't heal in there, and the bone will not fill in there. So it's a very difficult scenario to actually see if you have a capacity to grow bone. They'll do everything they can, but that's the limiting factor, is will you actually grow the bone in there, because graft materials will not hold the implant. Don't believe that that's going to happen at all. Graft materials act as a scaffold for you to grow bone, so that you then mature the bone into this area, and then you have an area where you would put implants in. So you won't know whether or not you've grown your bone into the graft materials and turned over the graft materials for at least 10 months or so. So a treatment plan trying to put implants into this site can easily run out to be about a year and a half, because once you do have bone after 10 months, you're looking at putting an implant in and waiting 3.5 to 4 months or possibly more for that implant to heal. Then you got to get the prosthetic on top of that, and then you got to see how well that's going to heal long term. When those heal up and those are successful, that's great. It takes a lot of effort and a lot of bone healing events to actually make that occur. So that would be a lateral sinus lift. You would be bringing the bone in from the side here to fill that type of volume. And one thing that you want to make sure that that oral surgeon has the capability is something with the CT, because this person has a vital organ here. So there's some arteries and veins here. So when they cut through that window, you got to make sure you don't cut that, because it's a very difficult bleeding situation to manage clinically if you get into that site. So everything has to be fairly low, and usually they can do a pretty good job of about this much width going in and then filling the entire sinuses as far as they can, so that bone will mature into that area. So let's skip that site because I'm not interested in that, and let's look at this tooth site here, the next site over. I'm interested in trying to get people teeth back than trying to do heroic surgeries. And here's the first site that we have that could mature more easily and more predictably for an implant. So when we take this tooth out, there's going to be a void. Most of the area here, from the bone here, the tooth here, you have bone here to here. And so you want to maintain this structure, so when you put an implant in, you have enough to do. So let's take a look at that. Let me see if I can find that implant. So here's an implant that was chosen for this site, and it looks like it's a fairly wide implant and maybe a short one. So it's about a 5mm implant at an 8mm length. So this looks like a very doable size implant for a locator type attachment or another attachment for a prosthetic to go on top. So that's pretty good. You have a very small fenestration or opening into the sinus area right there, but that's not enough to want a graft. I have to have at least 2mm into the sinus before I start adding graft materials into the sinus, but that's a very small little bump, and that's totally fine, and that will heal over very, very well. These are very successful, but what you need to do first is graft the socket site first, allow that to heal for 3.5 to 4 months, put the implant in, then you let that heal first. So you have an 8-month healing period around this entire socket site, and those are generally very successful. The next area that we're looking at is right next door, but we don't want implants right next door because it doesn't really add any value for a large case. The value of implants across the entire arch when we're looking at the arch form like this, we want the implant here, like a four-legged stool. We want something here, 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 and then here. If I could get that back further, that would be better, but we already looked at the sinus and said that that's not going to be possible without a lot of heroics. But we're interested in here, so let's look at this site next to it. This is our infected tooth, so we don't want to go into that side. So we're going to look at right there and see how good that particular area could be right here. So let's drag over our viewpoint right there, and it looks like this. So the bone looks really good. It's a little dense. So the harder the bone is, the harder it is for your bone to actually heal around a dental implant. The same is true for the opposite. So you don't want extremes. You don't want very hard bone, and you don't want very light bone. It's not good for implants to heal up in either one of those scenarios. So you want something in between. This is still good bone. It's just getting a little bit more dense and harder. So let's look at that. And I believe, let's see. Here's an implant that we can put in effectively. We have good sound bone all the way around that implant, so we like that a lot. Now the next implant site that we would choose is something way over here in the canine position. We have central, which are these two front teeth here. We have the lateral tooth, which is the one next to it, and then we have that canine tooth. It's the pointy, sharp, big one, and that's the site that we're going to be looking at to kind of spread it out. And so if we look at our arch, we got 1, 2, and now we're looking at 3, and then we're going to look at an implant in this area next. But this is a very good site for that. Let's take a look at that. There we go. So that's that site. And see how the bone has a little bit more porosity, but it still has density. This is ideal. This is a dream. This is where we know that this is going to heal very, very well with this case. And so we don't have any concerns there. About the only concern may be the angulation relative to the prosthetic, but otherwise that's perfect. Now let's see how far back we could go, because we're looking at something here because we can see the sinus dropping through here. And as we go back, we're going to look at the bone, and let's look at it from this point of view. So we're going to go back through the bone, and what's happening is that the shape changes. So when we go here, we have a nice shape for the implant, and then we start to lose a little bit of the shape, become a little more pointy like this, and then the sinus is starting to drop. So we're starting to run out of bone here, coming down to almost nothing. This is now in the first molar position. We're going to go back up here. We're going to try to aim for about here. So let's see, we have an implant to put in, and that's what it's going to look like. So that's the nice implant placement. We're a little bit on the crest, it's a little bit thin, maybe we drop it a little bit more, but overall the actual implant here will be a nice sound bone, and maybe we drop it a little bit further in and get that going. So this is a nice case to do. We'll get a decent stability factor when we take our denture out to the first molar position. If we wanted to increase the stability of that denture later on, we have a nice foundation of those 4. We can add over bars that then have the locator attachments split further away. If you were to do a fixed piece, a hybrid piece, this would be an appropriate spread. If I were to do a fixed hybrid piece, I'd probably consider putting 2 implants in the front here as well. But I don't like that with most cases because it becomes a little bit more challenging on restoring in the front, and patients' sensitivity to their lip bulging out or anything like that is difficult to overcome. So we try to stay away from the front area, but in his case, the only other opportunity to put implants would be in between these 2 implants, which you could do, and that would strengthen the longevity and possibly the stability of anything that you would possibly do. So this is a nice full upper arch case. we would be doing a removable case. If you've watched our other videos, you'll understand why I'm not a big fan of all-on-4 or fixed hybrids. So please look at the other videos off the website that we have. And we will be doing more and more live streams, so we will be posting through our website and through other media, social media sources, when we're going to be doing this live stream. So if you have any questions and you have any thoughts, you can email us those. You can email us pictures. You can comment on our YouTube channel. We'll look at all of those things, and we will decide on what our next live streams could be. We'll talk about products. We can talk about full arch rehabilitation treatment planning cases like this. We will follow some cases that you will see how the treatment ends up. Not everything comes out perfectly sometimes. Sometimes things require more attention later on as well. We'll talk about those things. Those are the things that are very important when you're starting to invest and look into full mouth rehabilitation type treatment plans. But yeah, if there's anything dental you want to talk about, tune in and we'll get to you as soon as we can. Great. Have a good night.